Hold the curtain for privacy. Hi, my name's Josie and I'm going to be your student nurse today. I'm just going to gel my hands and put some gloves on. How's your day been?
My day's been great, thank you.
You're welcome. Alright, so it looks like you just need to get some information about your health history, do a general survey, and then look at the head, neck, and your musculoskeletal system and your integumentary system. Does that sound okay?
Yes, it does.
Okay, so I'm just going to check the physician's orders. Can you please verify your name and date of birth?
Penny Lindholm, 3/12 of 1970.
Perfect. That all looks to be treated correctly. And do you have any allergies?
No, I don't.
Okay, that's good. So first, what I would do is a general survey. So that's looking at the overview of your body. So assessing things like any physical or emotional distress, which you do not appear to be having any. Looking at your age, your race, sex. So female, Caucasian, early 40s. Then looking at things like your body type and posture, you know, making sure everything's symmetrical and distributed evenly, which that looks good. Looking at your gait, so how you walk, which we'll look at that a little bit later. Looking at your speech and listening as how you've been communicating with me. It doesn't sound like you have any speech impediments or any troubles communicating, so that's good. Then assessing your mental health, assessing your personal hygiene and your grooming, you know, you're dressed appropriately for this appointment. You seem to be well groomed and taking care of yourself. There's no odors, nothing like that. And then I would assess for your height and weight. And also, I've taken your blood pressure and apical pulse, so we're all good with all of that. So now, what I'm gonna do is I'm gonna assess the body. So is it okay if I touch your hair?
Yes, it is.
Okay, so when we're assessing the hair, we're just looking at the color, the texture, and the distribution. So it looks to be golden brown. The texture is shiny and smooth, which is good, it's healthy, and the distribution is even, it's good, so it's all distributed well, which is good. So next I'm going to feel your scalp, and we're just looking for any lumps and bumps, making sure nothing's going on there, which doesn't feel like there's anything going on, so that's good. And then next I'm going to take a step back and just look at your face. You know, look at the symmetry of your face, make sure one eye is not drooping more than the other, the nose is aligned and not drooping at all, or not over to one side more than the other. That looks good. And I assess your ears, make sure that they're even and level, which they are. And then your mouth, can you smile for me? Good, that looks to be even and good. So we're all good up there. Next, I'm gonna assess your nose, and like I said, the nose isn't leaning to one side more than the other. But I'm just gonna take my flashlight, and I'm gonna look inside and make sure that's all good. Looking at your nasal cavities, make sure there's no abnormalities or sores in there, and we're good. Can you then take your right finger, or one of your fingers, and place it on the right side of your nose for me? Take a big sniff in. Good. And then can you switch and do it on the other? Perfect. Didn't sound like you had any problems, any obstructions doing that, so that's good. Next, I'm going to feel your sinuses, your maxillary sinuses and your frontal sinuses. Let me know if there's any pain or discomfort. It's good. Good. Okay. So that all checked out. You look good. Doesn't sound like you have any sinus infections or anything like that. So that's good. So next, I'm going to look at your mouth. So can you smile for me again? Good. Next, I'm going to palpitate your lower lip and your upper lip just to make sure there's no lumps and bumps or anything like that. I'm going to bring this out. Yep, don't feel any there. And that checks out too. Next, I'm gonna just look at your lining of your cheeks, look at your teeth, your gums, make sure there's no discoloration or anything like that going on there. And that all looks to be good. Next, can you lift your tongue up all the way for me so I can check under? Good. No discolorations there, no sores. Can you move it side to side? Perfect. I'm just gonna feel it, make sure there's no lumps and bumps on that as well. Okay, that's good. And lastly, can you say ah for me? Ah. Good. This just gives me a clear view of your tonsils and your uvula and your oral pharynx. And that all looks to be good and healthy, symmetrical, no discoloration, so that all checks out. So now I'm just gonna discard these gloves, gel my hands, and get some new ones since I touched your mouth. Okay, now I'm going to look at your neck, and we're just going to check out your lymph nodes. Make sure there's no inflammation going on. So I'm going to start back with the occipital lymph node, which is located back here. I don't feel any swelling with that. Next, we're gonna move on to the posterior auricular, which is right behind your ear. That feels good. We're gonna look at the preauricular, which is right in front of the ear. That feels good. Then we're gonna look at the tonsillar submandibular, which is located right in here. And I don't feel any inflammation with that. Your submental, which is located right in there. That feels good. Then we're gonna look at your posterior cervical, which is located right behind your sternocleidomastoid mastoid. And that's good. We're gonna look at your deep cervical, which is located right in front of that. That feels good. We're gonna look at your posterior anterior cervical, which is located right in here. And that's good. I don't feel any inflammation. And then can you shrug your shoulders, and I'm gonna look at your supraclavicular right in there. And that doesn't feel like there's any inflammation there, so that's good. And I'm gonna check your thyroid. Make sure there's nothing going on there. Okay, and that feels good. Okay, so next I'm just gonna look at your skin. I'm gonna observe the color, check out any skin lesions, the temperature. That looks to be good on this arm. This looks to be good. The only type of skin lesions I'm seeing are macules, which are just your typical freckles. They're flat-coated, or they're flat-colored portions of the body. So it's all these little freckles that you see right there. Those are known as macules. So next I'm gonna assess your legs, the color, feel for any edema, which is fluid retention, which I don't feel any. The temperature feels good. No discoloration. Just gonna press my fingers to the skin, and it returns, the color returns right away. So that lets me know that there's no edema there. And the way that we measure edema is that a +1 is when you press on the skin, there's a little discoloration, but it comes back right away. And that is, it's 2 millimeters. And then we go up to +2, and that is a little slight longer wait for the color to come back, and it's 4 millimeters. And then +3 is 6 millimeters, and +4, which is the highest, is 8 millimeters. And that one really takes a while to come back, but that all looks good. Your skin looks good. The temperature was good. The color was good in all the spots I looked at. The lesions, like I said, you just had macules, which are flat-coated colorations of the skin. So that all looks good. So next, I'm going to check out your nails. And this, I'm just looking for color, shape, capillary refill. And the capillary refill is when I press put a little pressure on your nail, the color comes back within a second, which is really good. Like I said, the shape is good. There's no evidence of clubbing or biting your nails, so that's good. The condition looks good. They're smooth, so all of that checks out. So next, I'm going to check your musculoskeletal system, okay? So I'm just going to have you stand real quick, and I'm going to look at your overall, like the symmetry of your body, make sure nothing is out of ordinary, make sure it's distributed all well, and it looks to be your shoulders, your scapula, everything looks to be equal and all of that, iliac crest, everything. So then I'm gonna look at your knees, and your knees aren't inverted at all, nothing like that, so that looks good, they're straight on. So next, I'm gonna have you just walk 5 feet that way and 5 feet back, and I'm just gonna monitor your gait to make sure there's no signs of needing assistive devices to walk. Make sure it's good, you're not leaning more so to one side or the other, and that's all good. Then before you sit down, I'm just gonna have you lean over, and I'm gonna check your spine. When we look for spine, the abnormalities we're looking for are known as scoliosis, which is curving of the back, and kind of in an S shape, or kyphosis, and kyphosis is when there's rounding in the back, so like the Hunchback of Notre Dame, how they had that hunchback, the roundedness of the spine. And lordosis. Lordosis is kind of like an inverted of the spine. It forms almost like a soup bowl in the lower back, but feeling this, I don't feel any of that. It feels normal. Okay. So I'll have you take a seat for me.
Okay.
And that felt all okay and everything?
Yes, it did. Thank you.
You're welcome. Okay, and so now we're just going to do some range of motion exercises just to test out your muscles. But actually first, I'm just going to check your joints real quick. Make sure that there's no swelling or no pain or discomfort with any of this. So you let me know if there's any pain or discomfort.
It's good.
Let me check your hips real quick. Good. And then your ankles. And all of that felt to be good.
Yeah.
Okay. So now what I'm going to do is I'm going to place my left hand on the right side of your head, and I'm going to have you try to look my way. You're going to resist my hand. Okay? Then we're going to do the left. Perfect. Okay, now what I'm going to do is I'm going to place my hands on your trapezius muscle, and I want you to shrug your shoulders up and try to resist that. Good. Next, what I'm going to have you do is I'm going to have you sit up just a little bit, lean forward just a little bit, and then you're going to stick your arms out, and I'm going to check your deltoid muscles. So I'm going to have you push up. Perfect. Push down. Good. And we're going to check your biceps and your triceps. So can you show me some muscle in this arm? Okay. We're going to work on your bicep. You're going to push out as I push in. Okay? Good. And I'm going to pull it towards me for your triceps. Good. Now I'm going to try this side. Push inward for your bicep. Good. And outward for your tricep. Resist me pulling outward for your tricep. Perfect. Just like that. That was good. So now I'm going to look at your wrists. So I'm going to have you hold your hands out. Okay, and I'm going to push some pressure on them, and you're going to resist the pressure. Good. And this way, I'm going to push upwards, and I want you to push down. Good. Okay, what I'm going to have you do now is extend your fingers, and I'm going to push them together, and I want you to resist that. And this is known as adduction when you're bringing them together. Okay, that all looks good. So next, I'm going to work on your quadriceps. I'm gonna work on your hips. I'm gonna work on your hips. And what I'm gonna have you do is I'm gonna place, you can spread your legs out a little bit, and I'm gonna place two hands right here, and I'm gonna push outwards, and I want you to push inwards. Okay, you ready? Push in. There you go. And then when you're bringing them, that was adduction, and now abduction, you're gonna try to spread them out and resist my hands pushing them together. Perfect. Okay, and then we're going to check on your hamstrings. I'm going to pull your leg towards me, and I want you to resist that, okay? Good. We're going to do the other leg. Good. Now I'm going to push inward, and I want you to resist that. Perfect. This one. Perfect. Okay, then what I'm going to do is your feet. I'm going to place my hands on top of your feet and put some pressure, and I want you to try to raise your toes to your nose. Okay, ready? So lift up your feet. Good. And then I'm going to have you push downwards like you're pressing on the gas. Perfect. That was good. Did you have any pain or discomfort with any of that?
No, I did not.
Good. And I forgot, I missed one thing with your hands. I'm going to have you do a grip test, and I'm just going to have you squeeze. You can keep your hands straight. I'm just going to have you squeeze my fingers for your grip test. Perfect. That was good. So there was no pain or discomfort with any of that?
No, there was not.
Perfect. And like I said, overall, your color, your temperature was good with everything. I couldn't tell. You didn't have any, anything abnormal going on there, so that was good. And everything turns out well. I don't see anything for concern, so that's good. Is there anything I can do for you while I'm here?
Nope, everything is good.
All right. I'm just going to discard my gloves and wash my hands, so you have a good day.
Thank you very much. You too.
Thank you.